Welcome to this homeless training. I'm joined today by Lindsay Stevenson, who is a mental health addictions health promotion specialist with the Department of Health. We're grateful to have you with us today, Lindsay. Thanks for sharing.
Yeah, Carl, thank you so much for having me. Really grateful to be here. So as Carl said, my role with the Department of Health is as the Mental Health and Addictions Health Promotion Specialist. So in short, I represent the Department of Health within the mental health and addictions field. I also do a lot of education. I provide a lot of resources to the community. And so one of the education pieces that I do is a Narcan training or naloxone. You'll hear me use Narcan and naloxone interchangeably. Narcan is the brand name and naloxone is the generic. And in short, naloxone is an opioid overdose reversal medication. So when we're looking at opioid overdoses, this is something that we are able to use to hopefully bring somebody back from an opioid overdose so that it doesn't ultimately lead to a fatality. So we're just going to talk a little bit about it today. I'm going to look at some local trends as well, like what we're seeing locally in St. Joseph County, and then also just a little bit more about opioids and what naloxone is, how it works, and then also just some treatment options that are available in our area just for reference. So I'm going to go ahead and get started. Let's see. Brief technical difficulty. Here we go. All right, give me just a second here. There we go. Okay, sorry about that. Okay, so as you can see, this is our data from 2024. We're still waiting on our final data from 2025. That can take a little bit of time for us to get all of the overdose reports in. But in 2024 total, we saw 787 overdose reports. These are the actual overdoses that were reported in 2024. So we know that this number is not actually representative of the total number of overdoses that we saw in 2024. There's a lot of overdoses that go unreported, just for the fact that there are people who use Narcan on somebody else and then they're not calling 911, they're not calling it in because maybe that person has ended up, coming back from that overdose and they've left, they're done, and they're gonna move on, and at that point there's no reason to call 911 because there's no longer a person to be taken care of. I will talk a little bit later about the importance of calling 911 after you've used naloxone. It's important just for yourself to be able to keep yourself liable. However, we'll get into that later. So again, 787 overdoses in 2024. In 2025, we are looking to be just about the same as that number. As far as I can tell, we're going to be maybe even a little below or right at that 780-ish mark. Again, this is not accounted for all the overdoses that go unreported, but that is at least a good number for us to start with. Now, thankfully, we are seeing a decrease in overall overdose deaths. We've been seeing this decrease for the last few years. Each year since 2021, actually, our overdose deaths have decreased. So our preliminary number in 2025, we are looking at 42 overdose fatalities. However, that's down significantly from 73 in 2024. And then again in 2023, we were looking at 91. And prior to that, we were up over the 100 mark in terms of overdose fatalities. So I think we can attribute a lot of this to the increased access to naloxone, but we can also attribute it to a lot of awareness and education and trying to reduce stigma around overdose or around opioid use, around substance use as a whole. And we're seeing more people entering treatment, and we're seeing more of a need for treatment facilities. We've been fortunate in the last couple of years to see more treatment facilities open. We've got another one opening in just a few days in Mishawaka. And so really grateful for the access for people to be able to seek treatment when they need it, when they want it. As you can see, the snippets that are there, the highlighted parts are actual from death certificates in St. Joseph County from 2024. And the number one substance that you'll see across the board is fentanyl. So fentanyl is in everything. I tell people who are in active use to be aware of fentanyl. We've seen it. We see it in marijuana. We see it in, in people think that they're just getting, a OxyContin or an Adderall, and we're seeing everything laced with fentanyl. And so it's super important for us to be aware of that. I don't think any of us are new to the fentanyl world, but yeah, it's cheap, it's easily accessible, and so it's something that a lot of our dealers are just kind of putting in everything. So fentanyl is our kind of our number one substance in terms of use and fatalities, unfortunately. Of course, substance use disorders are common all over the U.S. Drug overdose has been the leading cause of accidental death for the last several years. And so this is not something, we're not unique in this. This is a common thing that we're seeing across the United States. But I do want to just briefly mention a lot of people have questions about why an overdose is considered an accidental death. I think there's a lot of stigma and a lot of misconception around overdose and what leads to that fatality. But most of the time, those with a substance use disorder are unaware of the potentially fatal amount of the substance that they're using. I have a lot of people who are in active addiction who say that, oh, I just got the same thing that I always get, or I just asked for the same thing from my supplier. And they're just not aware that there was a deadly amount or a potentially fatal amount of fentanyl or opioids or whatever it was in the substance that they were using. Most of the time, individuals who are using substances, their intention is not to overdose. Their intention is not to die. Their intention is not to, to get to that point. Really, because of the way that addiction works in their brain, their intention in using is really just to feel normal. It's just to be able to live. So that's why it's an accidental overdose. It's not something that they're intentionally trying to do. They're not intentionally trying to die. They're not intentionally trying to overdose. They're really just trying to feel normal. And again, it's just because of the way that addiction kind of rewires your brain, that they feel like they need, in order to live, we need that substance.
And that number has been dropping the last couple of years, correct, Lindsay?
Yes, it has. Yep. Substance use disorders are pretty common. In Indiana, 1 in 12 Hoosiers meet the criteria for a substance use disorder. And so I just think it's important for us to be aware that these are people that, it's not just, I think there's a stigma around like, oh, it's just this certain population or this certain group of people that are at a higher risk for overdose. And that's just not the case. There's people across the board, people probably that you work with, people that that we see in our day-to-day lives that would potentially meet the criteria for a substance use disorder. And there is a range. There's mild disorders, there's more extreme disorders, but I think it's just important for us to recognize that. I also want to mention that this does not include sugar or caffeine, because that number would be a whole lot higher. And I think a lot of us would fall into that category. But yeah, I think it's just important for us to consider the prevalence of substance use and recognize that it affects a lot more people that we likely interact with on a regular basis. All right, so looking specifically at opioids. So at their best, opioids are one of the most effective medications for pain management. There's no denying that. It's certainly, they're not, opioids are not all bad. I think there's been a lot of like, oh, we need to avoid opioids at all cost. Opioids are a great pain management, tool as long as they are used as prescribed, as long as they are used appropriately under the supervision of a doctor. Unfortunately, at their worst, opioid misuse leads to tens of thousands of deaths in the United States each year. We've talked a little bit about some of the different types of opioids, fentanyl, heroin was one of the common ones. I think this image just gives us a little bit of a better idea of, so especially some of the ones that are prescribed. It's a little bit more of an inclusive chart. So you'll see hydrocodone, oxycodone, morphine, codeine. Those are some of the more commonly prescribed opioids that we see. You'll also see methadone and buprenorphine. Those are used as a type of medication-assisted treatment. So it's a lower dose of an opioid that is really used to help somebody with an opioid use disorder manage that kind of that need, that desire for the opioid, kind of helps them wean off of maybe some of the more extreme opioid options. Excuse me. You'll see fentanyl on there, and this is the thing about fentanyl. Can be prescribed, so it can be prescribed as a pain reliever, but it is also illicit. Most of the time, we're seeing it as an illicit drug. However, fentanyl, when it's prescribed, is usually in some of the most extreme cases. So it's somebody who is in having pain management in hospice. That's kind of like their end of life support. And this is what is helping them feel the most comfortable at the end of their life, is fentanyl. Somebody who is maybe experiencing really extreme side effects from chemotherapy when they have cancer. Fentanyl is really reserved as a prescription for people who are really experiencing very extreme pain and need some a more intense pain management. It's always under the supervision of a doctor, and so I think it's important. I think a lot of people will say like, "Oh, it's just a prescription." I've heard that a lot from people who have fentanyl in their system, like, "Oh, it was a prescription." It likely was not. We are only seeing those prescriptions really in the cases of those extreme pain management needs. And here's some of what we see. Again, a lot of this is the prescription aspect of it, the pills. Codeine often comes in the form of like a cough syrup. We're seeing less and less of that prescribed, again, just because doctors are more aware of the effect that opioids can have. And so we are seeing a little bit more of a controlled, a little bit more control around the substances, the opioids that are prescribed. But morphine, oxycodone, these are some of the ones that we hear about the most often in terms of prescriptions. And then our two most popular illicit opioids. So in St. Joe County specifically, we do not see heroin. I don't remember the last time I saw a drug screen with heroin on it. I know a lot of people think they're on heroin in St. Joe County. I hear a lot of people say like, "Oh, it's just heroin. I know how much heroin I can handle." The problem is that we don't have heroin. Heroin is not really available. It's not really accessible in St. Joe County. What people think is heroin is actually fentanyl. We still have a lot of suppliers that are saying like, "Oh yeah, I've got heroin, I've got heroin." And people are like, "Oh great, that's what I'm used to. That's what I use. I know my limits on heroin." And then they're actually getting fentanyl, which is why we see a lot of those overdoses, is because people are not aware of what's actually in their supply. They don't know what they're using. And that's what can lead to an overdose. Fentanyl is much more potent than heroin is. I always say that drug dealers are some of the most creative people I know. They're very good at marketing their product. And so these are some of the things that we have seen, just that the DEA has seized from different suppliers, from dealers that they have found. So we have fentanyl chalk. We have these fentanyl pills that basically look like sweet tarts. Pink cocaine, which is actually not cocaine at all. It's a mixture of fentanyl, and in this case, it's a mixture of fentanyl and xylazine, but it's made to look like a pixie stick. And then fentanyl gummies. So all of these creative, things that kind of look like candy, they all contain some mixture of fentanyl and something. a lot of people assume that a substance in this form can't be that strong. I hear people all the time like, oh, you can't overdose on gummies, right? Well, sure, there are some gummies that likely it would be difficult to overdose on. But if you don't know where your gummies come from, if you don't know where your substance is coming from, then you don't really know what's in it, right? And when it comes to fentanyl, a tiny amount is all it takes to lead to an overdose. So this here, the little amount of powder that you can see next to the penny and on the pencil tip, that is the amount of overdose, or sorry, the amount of fentanyl needed to send an average person into an overdose. So it's pretty easy to hide this amount of powder in a pill or a gummy without anyone being aware that they're even consuming or using that fentanyl. Anytime substances are seized by the DEA, they are tested for levels of fentanyl. So in the last few years, half of the pills seized contained a lethal dose of fentanyl. And the pills look just like these here. So, when our kids are trying to get Adderall to help them function at school, when we have people that are getting oxycodone on the streets, that they truly think that they're getting oxycodone, it's possible that they're actually getting a lethal dose of fentanyl. They can look exactly the same. Pill presses are pretty easily accessible. So when we have suppliers that are out there and they're saying that they're selling Adderall, they're saying that they're selling oxycodone, it's pretty easy to get access to pill presses and add fentanyl to that oxycodone, or just to create a pill that's really just fentanyl and some other type of powder. So it is possible, anytime that we are getting pills, getting substances from somebody other than a doctor or a prescriber, that we are actually getting a lethal dose of fentanyl. As you can see on the image, the bottom left-hand side of the screen, heroin is actually, it takes a lot more heroin to send somebody to an overdose or to be lethal than fentanyl. And then we also are looking at carfentanil as well. Carfentanil is another derivative of fentanyl. We're seeing kind of a lot of different variations of fentanyl and a lot of derivatives of it. Carfentanil, norfentanil. So again, fentanyl it's potent, much more than heroin, and then there are also derivatives of it that are even more potent than fentanyl.
And carfentanil is like a elephant tranquilizer. Typically, is that what it's used for by vets?
That's xylazine.
That's xylazine.
Xylazine is
Okay.
xylazine is the tranquilizer. Yeah. Yep. So we're going to talk real quick about how an overdose happens. So we all have opioid receptors in our brain that block the pain signals between our brain and our body. And when we take an appropriate amount of opioids for our body, these receptors can easily support that amount and block the pain. So again, that's why when we're going to the doctor and the doctor prescribes an opioid to us, they're looking at our gender, they're looking at our height and our weight, our body composition, to make sure that we are not getting a dose of that opioid that is going to, be inappropriate for our body. Which is why when we're leaving it up to, a supplier on the street, they're not keeping any of that in mind, right? They're not looking at our body composition and saying, oh, this is the dosage that you'll need. And so it's important for us to make sure that we are getting our opioids from a prescriber and from an actual pharmacy. An excessive amount of opioids ultimately overloads the receptors and leads to respiratory distress because of where our receptors are located in the brain. So this leads to respiratory distress, and that can then cause slow or stopped breathing, which is what leads to an overdose. An opioid overdose requires immediate medical attention. Time is tissue. And so when we are looking at somebody who is experiencing an overdose, we want to bring them back from that as quickly as we can to hopefully decrease the chance of prolonged damage. So the longer we go without intervention, the more damage that can occur to our brain. Ideally, we'd want to bring somebody back from an overdose within 4 to 6 minutes of it first coming on. It can be hard to tell if someone is sleeping or experiencing an overdose. So we want to attempt to wake them up by calling their name. If we know who they are, kind of all of the normal things that you would do to try to wake somebody up. One thing too that can be helpful, if you're comfortable, is rubbing your knuckles on their sternum. This creates a nerve response that will generally kind of rouse somebody if they are just sleeping. But if there's no response, we want to call 911 immediately and administer Narcan if we have it. Some of the things to look for in an opioid overdose, you'll see there on the image on the screen, that unresponsiveness or unconsciousness, pinpoint pupils, snoring or gurgling noises coming from the mouth, blue lips and fingernails, slow and shallow breathing, and cold and clammy skin. One thing that I like to mention, I think there's maybe a little bit of a misconception about when naloxone needs to be used. If somebody is conscious, we do not need to use naloxone. If somebody is able to tell you that they do not want naloxone, they don't need naloxone. I've had people tell me before, like, yeah, but they told me that they didn't want it. Well, then they don't need it. They're not experiencing an overdose. Maybe they have used a substance and maybe they're like out of it. Maybe, they're like kind of coming in and out of consciousness. But if they can actively tell you that they don't want naloxone, then they don't need it. They're not experiencing an overdose. So naloxone is only need to be used when they're unresponsive. They fully are unconscious, cannot respond. So again, Narcan is an opioid overdose reversal medication. It works by knocking the opioids off of the opioid receptors, which allows somebody to start breathing again. And I think it's important to note that Narcan has no ill effect if the person is not experiencing an overdose, or if they've used a substance other than an opioid. So again, it's not something that is going to hurt you if you use it. If somebody is just asleep and you use naloxone on them, it's not going to hurt them. It's only going to have any effect if there's an opioid in their system. I'm going to attempt to show a very quick video, and then we're actually going to be just about done. But hopefully this video will work. Carl, if you could let me know when we get there, whether or not it's turning on.
Yep, it's going.
Okay, so just a few key points from the video. Each nasal spray contains only one dose. So we don't want to test the spray before administering. It's not like a spray that we need to pump before it'll actually start working. As soon as you hit the plunger and the dose comes out, that's it. That's the dose. There's nothing else left than in that container. Also, one dose might not be enough. And in fact, in our area, with the strength of the opioids that we're seeing, it often takes 2 to 4 doses to bring someone back from an overdose. So you can continue giving doses every 2 to 3 minutes. You want to alternate nostrils each time. If you start with the right, you'll want to go to the left the next time. So one thing too that I like to mention is that our 911 dispatchers are very well trained in how to walk somebody through giving naloxone. And so it's one of those things where I don't expect, when I do these trainings, I don't expect somebody to just like remember all of the things that I have talked about, or how to administer it, especially if you're in the moment and you have somebody in front of you who is actively overdosing. You're not necessarily going to remember all these things. So when you call 911 and you tell them, I believe that this person has experienced an overdose, I just administered naloxone, or I'm getting ready to administer naloxone, they're going to be able to help you keep track of the timing. Every couple minutes, they're going to say like, okay, hey, are you seeing any responsiveness? What are you seeing in this person? And if you have access to more naloxone, then they'll go ahead and be able to kind of direct you to give it again, to see. And hopefully by that point, EMS would show up. They would take over the administration. But in the moment when you're waiting for police or fire to get there, you'll be the one administering, and they'll kind of help walk you through that. Um, Another thing is that it wears off in 30 minutes to 2 hours. So that's why it's important to call 911 right away. And what that means is when we use naloxone, it creates a quick reversal of an overdose. So we're basically sending somebody into withdrawal. Within that 30 minutes to 2 hours, we're going to start to see somebody experience a detox. So that's like the opioids are coming out of their system. And if you've seen anybody experiencing a detox or even withdrawal from a substance that they have become dependent on, there's a lot of physical symptoms. It's not only mentally challenging, it's physically challenging for their body. And so we want to make sure that if somebody is detoxing, that they are doing that in a medical setting. So when we call 911, the ambulance, the EMS is going to take the person who has overdosed to the hospital, to the emergency room, so that they can make sure that if that person chooses to stay and chooses to detox and hopefully maybe seek treatment, the emergency room can make sure that that detox starts off a little bit more manageable than what they would experience without being in a medical setting. So the other thing too is, I think maybe some of you have seen, a lot of people have seen when somebody comes back from an overdose, we see all kinds of videos and things, a lot of people will say like, oh, they were so angry when they came back from the overdose, or, I got punched, or I got kicked, or I was assaulted because I tried to save their life. It is very uncommon for something like that to happen. Will the person be disoriented? Probably. Will they even be a little bit irritated? It's possible. The most that I've ever gotten is somebody was mad because I ruined the best high of their life. You'll hear that a lot. Most of the time it's like, oh, you just, you ruined my high. That was a waste of money because I paid for that. But the reality is that, and I not that I'm going to rub it in, but I apologize, but I just saved your life. Like I brought you back from an overdose that likely would have led to a fatality. And so it is important to keep in mind that yes, they may be disoriented, they may be irritated, but ultimately a life saved can be a life restored, right? Like an individual can't seek treatment, can't get help if they don't survive that overdose. So I would rather someone be alive and frustrated with me than the alternative. So again, I think it's just important for us to remember that. And another thing too, again, this is why we call 911. So there are laws, especially in the state of Indiana. We've got a couple laws that protect us in the event that we have to give Narcan or naloxone. So as long as we call 911 after and wait for EMS and police to arrive and give them the information that they need or that they request on the scene, then we are protected by law. It's not somebody can't come back and sue us because we gave them naloxone, or even if they weren't actually experiencing an overdose, maybe they were just asleep, and we give them naloxone. These are laws that protect us as long as we are acting in good faith and don't display gross negligence. Again, it says that there, then we're protected by that law. So it's important to call 911 just to cover ourselves. All right, we're going to just look at treatment, and then I'm looking forward to maybe a question or two from Carl. The most effective treatment for opioid use disorder is medication-assisted treatment. And I hear a lot, well, aren't we just replacing one drug for another? If you want to look at it that way, sure, but it's in a much more regulated fashion. So these medications are FDA approved and highly effective when used correctly. And they are used in conjunction with behavioral therapy, with group therapy, with like under the aid of some type of outpatient program and sometimes inpatient program. They can help ease the symptoms of withdrawal, aid in a more peaceful detox, and help somebody who is entering treatment have a little bit more emotional stability as they make that step to try and move towards recovery, whatever that might look like for them. We have a number of facilities in our area that can prescribe this medication. Again, it's always aligned with support groups and treatment. It's not a miracle drug. It's not something that people are just going to take and it's just going to everything's going to be rainbows and butterflies. It's a tool that allows someone to have greater success in their recovery. Just like if I were to take an antidepressant for depression, it's not going to completely change my life. It's not going to cure anything, but it is going to allow me to hopefully have greater success as I'm processing through my depression, as I'm kind of managing those symptoms. Some people wean off of these medications as they continue in recovery, while others stay on them for most of their lives. It's similar, again, to taking a medication for mental health disorder. It can be extremely helpful as we put in the work to process the underlying causes and alleviate the related symptoms. We have a number of other resources in our area that support those experiencing substance use disorders. This list is constantly evolving, and all of these organizations play a huge role in the substance use community in St. Joseph County. So there's so much opportunity and hope for those experiencing a substance use disorder in our community. Treatment is available and recovery is possible. I don't expect you to remember all of those organizations. It may be easier to remember 211 or 988. Calling these numbers will link you to resources to help get recovery started. 211 is an incredible resource. They can often even arrange transportation to get someone to a treatment facility if it's out of county. And so, we only have a few inpatient treatment options for individuals with Medicaid. So we often have to send people to Fort Wayne or Indianapolis for treatment. So if you have private insurance, we have plenty of options, but calling 211 will really help get you connected with the resource that's most appropriate for you. And then, of course, we have the Oak Lawn Crisis Line. They'll be able to do some of the same things. Often they can mobilize to you if you're in a crisis situation that merits that. And so I think it's a helpful resource that we have here in St. Joe County. So those are just some numbers, some hotlines to keep in mind that can really be beneficial in helping us get set up with the right resources. Okay, and that's what I have.
That's great, Lindsay. Thanks so much for sharing. I wonder, where can people get Narcan if they want to have some available?
Great question. So we have on our map on the St. Joe County Department of Health website. I'm going to stop sharing. On the St. Joe County Department of Health website, we have a map that shows all of our public access boxes, or all of the locations that have naloxone. We have over 30 in St. Joseph County, and that number is continuing to grow. And so we also I have business cards, and Carl, I'll send you the QR code, maybe if you can send it out to the people who are here. We do have a little card that has a QR code on it that links directly to that map, so that if anybody is out in public, they can, kind of scan that code and see where the boxes are located. The health department gets a number of doses of Narcan. I'm usually distributing between 500 and 800 doses every month to different locations in St. Joe County. And so if any of your organizations or if anybody needs it, please reach out to the health department. I would be more than happy to supply you with a stock in case that would be beneficial to your organization.
What are some of the top sites where you see the most Narcan being picked up by the public?
Memorial Hospital and St. Joe Hospital. Those are the two top. We have a box at the Memorial Hospital emergency room. We also have a box in the main entrance of St. Joseph Regional Medical Center. And we see a lot of traffic at those boxes. Usually around 150 doses a month are removed from those boxes. But there's also boxes at each of the St. Joe County public libraries. We see a lot of traffic there as well. The Kroc Center, there's, quite a few locations that distribute it fairly frequently. Our Lady of the Road is another one that has a box, and it's often empty. Oak Lawn has boxes. So yeah, those are some of the areas.
And then one final question before we finish the recording. Is there an expiration date on Narcan? Does it last for a certain amount of time?
Sure. Yes, there is an expiration date. That expiration date is listed, or sorry, not listed. It's printed on the individual doses of Narcan. However, we also, the CDC has put out that the Narcan, as of right now, is good for 3 years past that expiration date. And we've heard of instances where it's good even longer. But if you have Narcan that's expired, use it. It's still better than nothing. And if you do have it that's expired and you want some that's not expired, reach out to me. I think the Narcan that I have right now doesn't expire until 2028. So I can always get you newer doses, but yeah, it does expire. However, it can be used up to 3 years past the expiration date, and is still just as effective.
Great. Well, again, Lindsay Stevenson with the Department of Health, thank you so much for joining us today.
Thank you, Carl.